Our client Andrew is a 25-year-old male with childhood onset fluency disorder. Now, for those of you who are not paying attention in 106, that simply means that he has a stutter. Andrew reports that over the past few years, the overall intensity of his stutter has increased dramatically. Secondary symptoms such as muscle tension in his throat, erratic movements of his lips and his jaw and his tongue, and even head jerking and eye blinking cause him a lot of pain within just a few minutes of speaking. He says that sometimes he'll even get stuck on the same syllable for 20 seconds or more, and his friends and family, well, they say that his stuttering episodes are painful to watch and frustrating.
Now, there are so many awesome and effective different strategies that we can use with adults who stutter. So when someone calls our clinic with a fluency disorder, we're always ready to help. But when Andrew called, he kind of caught us off guard. Take a listen to what he said.
Hi, my name is Andrew Tyler, and I'm calling to see if you guys can help me. I'm 25 years old, and I've been stuttering on and off my whole life. Every time I go to speech therapy, they have me playing board games and making small talk. I think that stuff is just a gimmick. It's like they're mocking me and belittling me, and I don't appreciate that. I want to work more independently. All I need are some strategies I can use in the real world when my stuttering gets out of hand. I'm not looking to be friends with my therapist. I'm looking to fix my stutter. Can you help me?
So you don't want to be my friend? Okay, can't help you. Sorry. Building a trustful relationship with our clients doesn't always mean that we'll sit down and have heart-to-heart talks. It doesn't always mean that they'll tell us about their weekend or even that we'll know when their birthday is. What it does mean is that we create a therapeutic space for them that really suits their personal needs, one that they can thrive in. In Andrew's case, it just means a little less face-to-face time. He doesn't want to play any more games, he doesn't want to be friends, he wants to work independently, and that's completely fine. So yes, Andrew, we can help you. Andrew is your typical mid-20s technology guy. He has a degree in computer science, he can tell you about the latest technologies, and he can code just about anything. Keeping all of this in mind, we decided to give the CAFE program a try for Andrew.
CAFE stands for Computer Aided Fluency Establishment Training. Isn't that a mouthful? Clinicians have long observed that opening the vocal folds and letting in a little bit of air before speaking immediately increases the fluency rate. So, CAFE is a computer program that teaches the client how to coordinate their breathing with the onset of speech, to speak without holding their breath, and to maintain the speech flow throughout the phrase. It's kind of like a physical therapy for the vocal cords.
So how does this whole thing work? Well, the client wears a respiratory sensor and a tiny microphone which both feed into the computer system. The CAFE program presents the client's voice and breathing as visual biofeedback on the computer screen. This way, the underlying physiological behaviors are being addressed through muscle retraining.
Andrew's CAFE program will have 3 parts. First, he will participate in semi-intensive therapy twice a week over the course of 5 weeks. Using the computer program, Andrew will be able to monitor his usage or lack thereof of proper targets during articulation. The clinician will help him mold the sounds he's having trouble with until he has satisfied the program standards. The second component of treatment is called transfer therapy. This involves adapting his new speech skills to his world outside of the therapy room and desensitizing difficult speech situations. Transfer therapy goes on until both the client and clinician feel it's best to move forward.
Throughout his semi-intensive therapy and his transfer therapy, we're going to advise Andrew to participate in the third component of the CAFE program, and that is group therapy. Group therapy is basically just where speech skills are practiced in a group setting. Now, we're not so sure if Andrew will want to do this because he's not exactly a social butterfly, but we're going to discuss it with him in today's session anyway and see if he's open to it, because we think that if he tries it, he'll find that it's a really beneficial thing for him. The reason why we chose the CAFE program for Andrew can best be summed up by a quote from Dr. Gordon Blood. He's the chairman of the Communication Disorders program at Pennsylvania State University, and when he was asked about the CAFE program, he said, quote, "CAFE is especially good for returning clients who don't want to hear any more from the clinicians. It's sometimes easier for clients to interact with the computer. It gives them something different because they've tried so many other things." Andrew is just the type of client that Dr. Blood is referring to. He really wants the help, but he just needs a break from some of the more traditional methods that he's used to. In today's session, you'll see the very beginnings of Andrew's semi-intensive therapy. That's the first component of the CAFE program. I'll introduce him to the program, he'll participate in his first session, and then I'll talk to him a little bit about group therapy and see if he wants to try it out. Really and truly, we just want him to know that we care about what he wants, and we're here to help him. Thank you all so much for watching, and I really hope that you enjoy observing our session today. Bye!